Welcome to Rekindle Therapy's podcast, where we aim to educate Malaysians about mental and relational health. This is our second podcast. Today, we're going to focus on psychological assessment. What is it? What is it not? And when might someone go for it? To handle this topic, I'd like to introduce the latest member to join our clinical team at Rekindle Center for Systemic Therapy here in Kuala Lumpur, Mr. Arman Imran Ashok. Arman joined Rekindle in October this year after completing his training as a clinical psychologist. His academic background includes a BA in psychology from the University of Minnesota, and then a Master of Clinical Psychology from the program offered by University Science Malaysia, University Pendidikan Sultan Idris, which we call USM, UPSI. Welcome, Arman.
Thanks for having me, Doctor.
So, to help us get to know you a bit better, tell us about your background. Why did you decide to study psychology for your undergraduate degree?
So, the main reason why I wanted to study psychology is to understand what makes a person tick. So, most of the time, we usually see the after effects of a person's thought, you see. We see the reaction end of it, like their emotional reaction or their behavior reaction to it. And adding on to that, from what I noticed through my past experiences, I noticed that there were these vulnerable groups, such as those who are having psychological distress, often go unnoticed or are often neglected here in Malaysia. So I believe that this is due to strong stigmatization, in our community. And did you know, Dr. JB, that based on a KKM report back in 2015, around 4.2 million Malaysians suffer from a form of mental disorder, and most of them aren't aware of it or not knowing where to go about and what to do about it.
Right.
Yeah. So again, this ties back to what I mentioned earlier, due to the strong stigmatization. So I would personally like to change that in this country by doing my part in destigmatizing mental health.
So, I'm hearing two main reasons why you went into psychology. One is to understand how the mind works, right? Sort of behind the behavior, what's actually going on in the mind.
Yes.
And then the other one is how can we help people, basically,
Yeah.
get more access to mental health care.
Yeah, exactly, correct.
And you knew this even before you started your undergraduate?
Yes, that is because like I can see it in certain communities, like I mentioned, through some volunteering programs as well. Yeah.
Right. Okay. And then, so when you did your undergraduate degree, you were already thinking, one day I will become a clinical psychologist, and you did your master's degree.
Yeah, something along those lines.
That's great. So, according to Dr. Daniel Seal, who is a British clinical psychologist practicing here in Malaysia, there are currently around 200 clinical psychologists in Malaysia who serve a population of 33 million people. This is very low compared to countries such as the UK, where 9,500 clinical psychologists serve a population of 67 million. So, to keep it simple, in Malaysia then, every one clinical psychologist will have to serve more than 160,000 people, compared to one clinical psychologist per 7,000 people in the UK. What are your thoughts about this?
So, despite the small number of clinical psychologists at the current time here, the pressure is still not that imminent. So, yes, there is a huge lack of awareness and there is a low mental health literacy. But as of now, there are more people in Malaysia who are slowly becoming more aware of that, and Malaysia will eventually, in the long run, feel the strain or whereby there are not enough clinical psychologists in Malaysia. So,
So what you're saying is, with greater mental health literacy, there will also be a growing demand
yes,
for the services.
yes, correct.
Okay.
And we can see that in the current academic programs offered in Malaysia. There are more masters in clinical psychology programs now offered.
Do you know how many there are in Malaysia currently?
I believe there are more than 7 universities offering the master's program.
Right.
So it is a growing, and I know that number is increasing still.
Right.
Yet, when we go to the government hospitals, the private hospitals and private clinics, we can see that it's still pretty much an underfunded area, and we are seen as secondary compared to other professionals.
Right.
Yeah.
Okay. So that's why we're doing what we're doing, is to try to increase the mental health literacy. And today we are going to focus, as I said earlier, on psychological assessment. You know, there are all kinds of quizzes on like Facebook or social media that help people to know themselves better, so-called. Sometimes it's about choosing your favorite animal or picking your top 3 colors, and then the quiz will tell you what kind of a person you are. Now, these kinds of quizzes were a lot more popular before. There are less now, at least based on my feeds. And I think it's because people don't take them too seriously. But I still see people doing it on my Facebook feed and sharing it. So how are these online quizzes different from an actual psychological assessment?
Well, one major takeaway from all these quizzes and personality tests that you see online is that they are not valid nor are they reliable.
What do you mean by that?
So what that means is that the results that you get from these tests should not be taken seriously, because you see, a lot of the psychological tests that professionals use, such as clinical psychologists administer, they undergo rigorous testing to make sure they actually measure what they're supposed to measure.
What do you mean by the tests go under rigorous testing?
Well, to make it in simple terms, is that there's a lot of research that goes behind making the test.
I see.
Yeah. Whereas you see this 5-minute BuzzFeed quiz online,
Right.
then there isn't much thought nor research that goes behind it.
It's
It
not
is
rigorously developed.
yes.
Right.
It is more of a fun thing that you do.
Right.
Yeah.
Right.
So it doesn't actually measure what it's supposed to measure.
Right.
Yeah, so whatever results that someone gets from this type of test should be taken with a grain of salt in terms of their reliability or validity.
So, one psychological assessment, can you give me an example? Like, how long did it take to develop that?
So, for give you a good example, for an IQ test, the Wechsler Adult Intelligence Scale, that would take a couple of years of research to develop with thousands of participants in order to get that form of data, baseline data.
Right. So, they had to spend a lot of money, a lot of time with experts just to develop that tool
Yes, exactly.
to be used with clients.
Exactly. Yeah.
Why is it important to have to do so much research to develop a psychological assessment tool?
So to put it in simple terms, we just want to make sure that what we're actually measuring actually measures the thing that we're trying to test or look out for.
What do you mean by that?
So like for example, let's say I have an assessment tool to measure ADHD.
Okay.
I want to make sure that the questions that are asked on that tool is related to ADHD and not related to something else.
I see. So it has to be very precise.
Yes.
I see. So I imagine that, when you ask the wrong questions, then you're kind of not measuring what you're supposed to be measuring. Is that right?
Yes, correct.
Okay. So sometimes I hear people use the term psychological testing and psychological assessments. Is there a difference between these two terms?
Yeah, I know. I can see how people can get these two mixed up at times. Yeah, so psychological testing is the administration of the actual test itself, that one product.
Such as, like
So-
the Wechsler?
Yes, correct.
Okay, for the IQ test.
Yes. And psychological assessment is an array or a battery of tests that we administer to someone in order to find out or answer a specific hypothesis.
You might use a battery of how many tests, let's say?
So, like for example, someone with ADHD, we may run the IQ test, we may do the adaptive behavior test, and the actual ADHD test. So, all in all, roughly 3, not including direct observation as well.
So you would do direct observation, and then you would also potentially, I guess it differs from case to case, but potentially 3 separate tools,
Yes, correct.
right? To be able to say what?
To be able to confidently say that this person most likely has ADHD or not.
Wow. Okay, so you could administer a whole battery of tests to be able to determine, I think you used the word confidently, is that right?
Yes.
Yeah, whether a diagnosis is accurate. right? Because you're looking into the minds of people, and you need to be very careful exactly what it is that you're looking at.
Yeah.
So, what are the different areas or disorders that can be covered through psychological testing?
So the psychological test that we use, I found that we can break it down to about roughly 5 major domains.
Okay.
Or 5 major areas. The first one would be cognitive. Now, the most common one would be the IQ test, like the
Okay.
Wechsler Adult Intelligence Scale. All right. So that will cover something which measures the entire brain functioning. But then on top of that, there are tests within the cognitive domain which measures specific areas of the brain's functioning, such as the CTMT, which measures the attention area of the executive functioning of the brain, or the Wechsler Memory Scale, which measures the temporal regions of the brain, which relates to memory.
So, you could have, what did you call these, cognitive tests?
Yes.
Yeah, so these cognitive tests are basically not really covering, say, if someone has a mental illness, let's say if they have ADHD, but this is kind of to figure out how their brain is functioning.
Yes, exactly.
In terms of their memory, their, what else?
Executive functioning,
Okay.
Memory, executive functioning. And in executive functioning, it breaks down to a lot of other subdomains as well, but we wouldn't get into all the
It sounds
nitty-gritties,
really
yeah.
complicated.
It can get complicated.
That's why you have to spend so many years to study it,
Yes.
to be able to confidently say that you know what it is that you're assessing.
Yeah, exactly.
Okay, what other areas aside from cognitive?
Yeah, so you mentioned ADHD, right? So that will fall under the neurodevelopmental category. So that will have assessments relating to ADHD, the autism spectrum disorders. So these are really common areas to be measured.
You use the word neurodevelopment.
Yes.
Can you kind of unpack that a little bit?
Okay, so neurodevelopment means that it's something to do with the functioning, neural functioning. So the brain's ability
The
to function.
neurology.
Yes.
Okay, got it.
Okay.
Yeah.
Of an individual as they are growing up. Okay. So many things can happen to a child as you're growing up, right?
Yeah.
Because you can have typically developing kids and those who differ from that typical pathway. So this is where these forms of assessments come in to measure and assess whether that person does exhibit symptoms such as ADHD or autism. And
So when you said growing up, that has to do with the development piece,
Yes.
right? Growing, developing, right?
exactly.
So
Yep.
neurological development aspect is
Yes.
the other domain.
yes, correct.
Right. Okay. Right. So some of these mental disorders are neurodevelopmental.
Yeah.
Right. Okay. Got it. Got it. What are the other domains?
All right, the next one is social. So social is more of like the person's adaptive functioning, or the most common one that people know of, personality tests, aptitude tests. So this will fall under the domain of social. All right. The next one would be more biological. So this is something that not many clinical psychologists can measure. It is a bit more on like the medical side already of things.
Give me an example.
Like testing for genetic history, etc. But these questions
Oh.
can be asked during the intake interview.
So you can do sort of genetic testing as well?
Not specifically like, in working in a lab or anything like that.
Okay.
But more of just asking questions of their extended family tree to see whether is there any other psychiatric history in their family backgrounds.
For example, what could be genetic?
So like autism and ADHD, even stuff like depression, neurotic disorders such as depression and anxiety, they have an increased risk factor in someone who has a relative who has been diagnosed with like depression or anxiety.
Right. So some of these could be running in the DNA.
Yes,
if you will.
exactly. Yeah. And whether it
passed
is
down.
expressed is a different story. That gene is expressed is a different story.
I see. So you could have the gene, but you don't necessarily have it expressed.
Yes, correct.
Right. So
Yeah.
that means you don't show it. You
Exactly.
don't have it.
Yes, correct.
Okay. Any other domains?
Last one would be emotional.
Okay.
Yeah, so I think most students or maybe those who working in a medical setting or in schools would be familiar with what we call the DAS-21, the Depression, Anxiety, Stress Scale. So this is a common screening tool that is used to measure these three forms of psychological well-being.
Okay.
Yeah, so other common forms of tools that I use in this category is like the back anxiety inventory and back depressive inventory.
So this is what in my field we'll call mood,
Yes,
right?
mood.
So that you're calling it emotions, but
Yeah.
right. And I think that we deal with these a lot.
Yes,
In a
exactly.
clinical, in a sort of more therapy orientation, oriented work.
Yes.
So you do more than just the therapy oriented work. You assess for a host of different domains within human mind and functioning.
Yes.
So you mentioned biology, right? Some people ask about seeing a doctor or seeing a psychologist or a psychologist, psychiatrist. They get very confused. What's the difference and which one should someone go see?
So our specialization, our first focus, my role as a clinical psychologist. So our specialization is a bit different, but we work really closely alongside with psychiatrists as well as other professionals. So now, let me put you in a hospital setting, yeah?
Okay.
So you would first be seen by a psychiatrist. Okay, and they would manage your case by prescribing medications if needed. And let's say if they feel like, okay, your symptoms can be further managed with therapy, and then that's when they'll refer you to a psychologist or clinical psychologist.
Okay.
All right. Now, it is also possible to see a psychologist or clinical psychologist first.
Now you're using psychologist or clinical psychologist. Is that the same thing or two different things?
I would argue it's two different things,
Okay.
because a clinical psychologist specifically focus on the more severe mental health disorders. All right, and it's more clinical in that sense. All right, whereas a psychologist, you can just have a master's degree in general psychology, but then jump around to different areas in the field.
I see. So give an example of what would a clinical psychologist do that a general psychologist may not do.
All right, so a clinical psychologist, one of the main areas of expertise of a clinical psychologist is administering assessments, like what I mentioned earlier, such as to assess whether the person has ADHD, autism, IQ tests, personality tests, etc.
Okay.
Whereas a general psychologist, they would be able to learn or measure in terms of the person's behavior, but not necessarily administer any forms of formal psychological assessments.
What are they doing with the patients in the hospital, the general psychologists?
So most of them would just generally provide any forms of psychoeducation or basic therapy.
I see. Okay. So even at that level, you would need a master's in, say, health psychology or something like that.
Yes, correct.
To be able to function in a hospital as a generalist
Yes.
in mental health. Right. Well, what about the psychiatrist versus clinical psychologist? Which one should one go see?
Okay, so that question is a bit difficult to answer because it really depends on the person's state of mind at that point in time. If it's something extremely severe, let me go back a bit. So how the Malaysian system works is that you will always be seen by a psychiatrist first,
Okay.
because Malaysia follows a medical model.
Okay.
So we always have to see the doctor first.
Okay.
All right. So from there, like I mentioned, they will assess whether, okay, are you stable enough to see a clinical psychologist or a counselor or psychologist.
So a psychiatrist would still depend on the assessments done by a clinical psychologist to help him or her have a more nuanced understanding of what's happening with this patient. Is that right?
Yes, to a certain extent, depending on the person's concern.
Such as?
So let's say if the person was referred due to stereotypical behavior, poor eye contact, late speech development. So then the psychiatrist may suspect something related to, like what I mentioned earlier, the neurological developmental disorders.
Right.
So then that's when they pass it over to a clinical psychologist to run the necessary assessments to see whether it supports the psychiatrist's hypothesis that this person has autism.
Right. I think most people don't understand that there's just this much complexity
Yes.
in the work. So before you joined Rekindle, you were in which hospitals again?
Yeah, I was in two hospitals, Hospital USM in Kelantan and
Okay.
Hospital Pengajar UPM over in Serdang.
Right. So I imagine there was quite a lot of busyness, doing clinical work and assessments there.
Yeah, a lot running around as well.
Right. So your choice to then come into a more private practice setting. Tell me about, what your intentions and hopes are.
Yeah, so my intention over here is to basically be able to assist clients, especially more those related with mood disorders or anxiety related disorders. Because you see, in the hospitals, it was a lot more extreme cases. You see,
Okay.
yeah, so it was a lot more, how you say, tiring.
Tiring. I almost get the sense like the prognosis maybe was not always so positive.
Yeah, exactly. Yeah, in the hospitals, the prognosis were not that great because of the severity of their condition,
Right.
which is why we worked alongside with the psychiatrist a lot.
Right.
Whereas over here in Rekindle, from what I notice is that people who come here seek help because they are in the early stages of their psychological distress. So
Right.
it is not to a stage where pharmacological intervention is required, nor do they require hospitalization.
Yes.
So I would say the prognosis for people coming to see the clinicians in Rekindle the prognosis is a lot better
Yes.
because they still are in a state of mind where they are able to function as well as apply the techniques and skills taught to them during therapy sessions.
Yes. And I can say that I can vouch for that. For the last 12 years, many people have gotten very much better coming here. And now what I'm hearing you say is it could also be the early stage of intervention, or maybe it's not so severe, right? That they're not so clinically entrenched
Yes.
in their problems that it's sort of more maintenance is the best that they can have. Although we do get more clinical cases as well.
Yeah.
And we try to help everybody however we can. And I'm really glad that you're here to bring in a more clinical piece here and also to be able to help people have better understanding of how to improve their mental health. And also, from my side, as a relationship specialist, the relationship help because they really do interact. So I know you can give me a lot of answers to this question, but if you were just to give me one piece of advice, just one piece of advice to the average Malaysian about psychological assessment per se, what advice might you give?
So I would say don't self-diagnose. Okay.
Yes.
Yeah.
Yeah.
So a lot of Malaysians or people right now, especially with in the digital age, right,
Yes,
tend to
yes.
self-diagnose,
Yeah.
especially with like apps such as social media platforms such as TikTok and
Right.
Instagram.
Right.
People just view certain videos for like 10 seconds and automatically assume like, okay, I have ADHD.
Right.
Right?
Right.
So if you come into a session, your answers are going to be a bit more biased in that sense. And it honestly defeats the purpose of the assessment that we're going to run because you would have that diagnosis at the back of your mind driving or being the motivational force for your answers.
And sometimes it can affect the answers too,
Yes,
right?
exactly.
Right.
So
So-
it's like a false positive, we would
Right.
say.
Right.
Yeah, so my advice is basically just come in with an open mind so that you can give a more truthful answer.
Right.
And that
Unbiased.
so that your answers are unbiased and your clinician or therapist would be able to explore the different possibilities with you as well.
Right. That's great. So there you have it, folks. A little short podcast on psychological assessments. If you have any questions, feel free to drop us a comment or drop us an email. We'll be happy to take any questions. And also, with your feedback, we can also create more podcasts. And I'd love to have Arman be able to do more interviews that can help a lot.
Yeah, that sounds great.
Yeah, that increase the mental health literacy in Malaysia. Thank you.
All right, thank you so much for having me.
Okay.